So my name is Heather, and for this test we're going to be doing a urinalysis. First we have to get the urine. We're going to do a free catch. Usually we get it in the tops of our vaccine containers, but when we run out of those, then we do just some regular Tupperware will work. So we're going to let our patient urinate. Go ahead. Go ahead.
I'm trying to get it.
Okay. So we just wanted to catch the urine without anything getting into it or any hair contaminating it. So now that we have it, we can run our urinalysis. Okay, so for this task, we'll be doing a urinalysis. So we've collected our free catch sample, and we are going to use our urine strips and also do a urine sediment. So we're going to start off by, we've put the urine into 2 tubes, and we're going to centrifuge this one. Make sure that it's balanced. Not as big as I thought. There we go. So that fit into there. And the tube will fit into here. We'll put that in. And then that will spin for, according to our make and model of centrifuge, for 8 minutes. So we'll start that now. Make sure that it's going. Okay, so now we will use the rest of our urine to use our test strips. Pull one out. Let me have it ready. And then before we even do that, we want to take a look at our sample. We want to notice the color of it, the clarity, how much there is. We're going to do the specific gravity, and we also want to see if there's any foam or if we've noticed any kind of an odor. So there was no odor when the sample was collected. It's, I'd say, like a medium to dark yellow color. I think it's a bit more concentrated. It was the first urination of the day for our patient, so maybe just slightly dehydrated. It's very clear. There's, nothing noticeable in the sample. There was, a good amount of volume of it that we caught in our Tupperware, but again, not out of the ordinary for a dog that was having its first urination of the day. And then there was no foam or anything like that. So now we will grab our refractometer and we'll test the specific gravity. Grab that. Okay, so for our refractometer, we are going to use our pipette and just place a drop onto the cover slide, and then we will put that over so it's on the screen, and then we'll look towards the light and focus it, and then we'll be able to see what the specific gravity is. So in between 1.03 to 1.04, so I would say it's 1.035. which is within the normal range. Normal urine-specific gravity is between 1.030 to 1.050 for dogs. If it's higher, then it usually means that the dog is dehydrated, either because of vomiting or diarrhea. We see it a lot in dogs that have been sick for a while. They're dehydrated because they've been vomiting or having diarrhea, and you can tell in their urine. Or sometimes with our diabetic patients, they'll have a higher than normal specific gravity. Low specific gravity can be due for a number of things like kidney and liver failure, Cushing's disease, Addison's disease, things like that. So a urine-specific gravity that is too low is sometimes cause for concern, and we would let the doctor know about that. But for this specific gravity, it is 0.0. No, sorry, I wrote it down wrong. It's 1.035. So it's within normal limits. We'll record that onto the record. So from here, we will use our dipstick test. We have the instructions on the side here, so we're going to be timing it to make sure that we're reading the results at the right time intervals, and then we're also using the bottle to compare the colors so that we can get a good idea. So we will again take our pipette and get a bit of urine, and then we just want to drop it onto each square. Get a little bit more, and then we start timing right away. So I've got my clock over here. All start at about 30 to 60 seconds, except for the leukocytes, which is 90 to 120 seconds. So. Okay, so we can start taking a look now. So we have our stick held that way, and let's see, we had it the other way around. So we can start taking a look now and writing down our measurements. So we can start at the top, which is the occult blood. It is yellow, as is the negative box. So we would write negative for blood. The next one is our bilirubin. That is also, if we look at it, we compare it to the side, it's at the starting color, so also negative. If it were positive, we would be worried about things like hemolysis of red blood cells, liver disease, kind of liver biliary obstructions, things like that. So negative is good. Next thing on our list that we're going to check are ketones. So ketones are another one down, and again it's at the negative, which is good. So we'll write that down. Having ketones in the urine can be from things like diabetes, also dogs that are experiencing anorexia or haven't eaten in a while. Starvation can cause ketones in the urine. Next on the list is protein, and again it's coming up as negative, which is good, so we'll record that. Protein in the urine can be from things like a urinary tract infection, renal disease, sometimes you will see it with. It also can be caused, you can have transient protein in the urine, which can be from stress, or a dog that's been running around a lot and is overly exercised, or a dog that has a fever sometimes will have some transient protein in their urine. But luckily this patient is negative. So the next one down is glucose, also negative, which is great. So we'll write that on there. And again, glucose in the urine can also be caused by things like diabetes, hyperglycemia, also sometimes in patients who have Cushing's disease. And then the next one is our pH. Normal pH is 7, that's neutral. It looks like our pH is just a little bit less than that. Looks like it's closer to the 6.5, so a little more acidic than normal. That can be due sometimes to a high protein diet, things like fever, again, starvation, things like that can cause acidic urine. Higher than normal pH of urine that's more alkaline, can be caused to things like a urinary tract infection, a dog who eats a mainly vegetable diet, you'll sometimes see that with, and also if you leave the urine out too long at room temperature, sometimes it can mess with the pH and give you a false reading higher than normal pH. So now that our urine is done centrifuging, let me just, okay, see if we can adjust this a little bit. Okay, so we have our urine, and what we want to do is take off the supernatant at the top. We want to get to the sediment at the bottom. So we will take our pipette and we will dispose of the supernatant in our urine until we are left with the sediment at the bottom. And we want to do this very carefully because you don't want to disturb the sediment after we've just spun it all down. Okay, so once that's been discarded, we're left with that on the bottom. And what we want to do is kind of give it a little flick to make sure that it's all kind of in this sample, and then we will add a drop of our SETI stain to it so that we can see under the microscope. Again, we'll give it another little flick to gently mix it, and from there we take our slide, we label it with our patient's name, and then using a fresh pipette we will take the sediment from the bottom and we'll place one drop onto our slide, and then we will place our cover slip on top very carefully. And now it's ready to be observed under the microscope. So we'll move it over to the microscope and we'll observe there. Okay, so now we are examining our stained urine sample under the microscope. Get it all set up and put on the slide with the cover slip over it. We start at 10 and just adjust it. I like to start at the end because the way that you will look over your sample is by doing kind of a zigzag. So I like to start at one corner, go all the way over, and then go up a field all the way back the other way, and to continue doing that back and forth until I've looked at the entire sample. So we've got it on 10, where you wouldn't notice anything super out of the ordinary. So then we would move that over to 40. And at 40, you can see a little bit if there's anything concerning. But the view that we really want to be looking at is 100. So we would move that over. And then this is when we would start looking. So when I edit this video, this is kind of a lengthier process, so I might fast forward through this part. But we'll begin looking, and we'll make notes of anything that we see. We're looking for things like casts, crystals, red blood cells, anything that seems unusual. Okay. And again, we go from side to side. Okay, so now we're going to take a look at some common things, casts, crystals, cells that you might find in a urinalysis or your observation of urine under the microscope. So we'll start with casts. Casts are little cylindrical microscopic structures. They're made out of some cellular debris, sometimes some protein. They are excreted by the tubules in the kidneys, and there are a couple of different kinds. So this kind is an example of a hyaline cast. They're the hardest to see. You can see that they, look kind of be difficult to really see that very well under the microscope. Sometimes they are also called fatty casts. And then there are also cellular casts. These casts are made out of cells. They could be red blood cells, sometimes white blood cells, epithelial cells you'll sometimes see in a cellular cast. And then we also will sometimes see our waxy casts. Usually we'll see waxy casts when we have a patient that has some renal issues. That's kind of when we see those most often. We also can see crystals in urine. So these are calcium oxalate crystals. They look like little squares with X's in them. Sometimes they're referred to as little envelopes. They're pretty easy to spot and to differentiate when you're looking at the urine microscopically because of their little X shape in the middle of that square. These are the crystals that we find most often turn into stones in our patients, so we try to catch them early. They happen more often in acidic urine. They can also be seen with ethylene glycol poisoning, so we're always keeping an eye out for those. I'd say the most common crystals we see are these struvite crystals, which are these right here. They look like long rectangles. Sometimes they're called coffin-looking crystals. We see them more often in alkaline urine. Sometimes we'll see them along with a urinary tract infection, but not always. And these just kind of really irritate the patient's bladder. And again, we try to catch these fairly early, and a lot of our patients that end up with struvite crystals are then put on a special diet to prevent them from constantly making more. We also sometimes will see ammonium biurate crystals. They have these little thorny projections, and they're usually like a yellowish brown. It's hard to get a good picture. We don't see these super often. They're found in Dalmatians and in bulldogs sometimes, but we don't really see a lot of these. And then we can also have some other things that we find in urine, like cells. So these are some squamous epithelial cells here that you might see. We can see some of these calcium oxalate crystals in this sample, and then also they're out of focus, but we have erythrocytes that you can sometimes see in urine, and also little bits of lipid, little drops. So these are all examples of things that you can see in a urinalysis. Luckily, our sample did not contain any of these, lucky for our patient at least. But these are the visualizations of those abnormalities.